So you get a broken clavicle. Let's see how this can happen. A fall from grandma down the stairs. A big football collision.
Number 59 comes clean and drives Romo into the ground. That's usually the shoulder.
Or even a college student tripping. Some current methods to mediate this are plate fixation with a bunch of screws, or pin fixation, where that pin just slides right through the clavicle. These result in nasty-looking scars with rehab of 4 to 6 weeks, with full recovery taking 3 to 6 months before these patients can get back to their normal lives. There has to be a better solution than this. What we're offering is our device, the Reamalign, alongside the answer pin. The answer pin is a minimally invasive pin that promotes fast and less traumatic recoveries for patients.
These are the basic components of the Reamalign, but its central role in clavicle fixation begs the question, what does surgery actually look like using Reamalign? This patient has a broken clavicle on his left side, or from our perspective, or the surgeon's, the right. The stabilization clamp is secured around the fracture site where its silicone mold prevents loss of reduction and alignment. Now that the clavicle's intramedullary canal is secured, the locking ball joint will be adjusted to wrap the Reamalign around the outside of the patient's shoulder. If the patient has broader anatomy, the surgeon may lengthen the device via sliding length adjustment as well. On the outside of the shoulder, the surgeon can line up the reaming aim to an entry point on the lateral end of the clavicle. Hypothetically, with the reamer secured through the lateral half of the fracture, the answer pin would then be simply pushed through the spongy intramedullary canal and secured by screw and cap endings.
The innovation of our design will attract many orthopedic surgeons and many investors. There are around 61,000 fractures per year, but only 12 to 15% of those result in surgery. One of our prototypes costs $124. If we say we increase that 15% to a 50% surgical rate and sell our device at $500, it will result in a possible revenue stream of around $15 million per year. Our device not only will increase the number of surgeries performed annually, but also will reduce OR time per case. This will create a larger revenue pool for both surgeons and healthcare systems. The global orthopedic device market is projected to grow steadily with an annual growth of 5.3%. We believe with your help, we will see the Reamalign in action in the OR. So I'm glad we can present the Reamalign, a time saver and more importantly, a life saver. OrthoSave, redefining clavicle fracture treatment through precision. Safer for patients, faster for surgeons, and more efficient for healthcare systems.